So good afternoon. In late March, my administration responded to an emergency situation at the Holyoke Soldiers Home. On March 30th, the superintendent of the facility, Bennett Walsh, was placed on administrative leave, and we dispatched a team of public health experts to the facility. They immediately set up a clinical health command team and testing operation for all residents and staff. All resources were made available to this team, including the National Guard, who's maintained a presence at the Holyoke Soldiers Home now for months. What wasn't clear at the time was the scope of the problem or how the situation had deteriorated to such an extent at that point. Shortly after that, on April 1st, I retained Mark Pearlstein, a former federal prosecutor, to conduct a thorough and independent investigation of what occurred. Mark and his team had complete autonomy to conduct his investigation and access to all pertinent records and individuals, and they did this project for free. The only state expense was a $26,000 staffing study. Mark and his team conducted 111 interviews with 100 witnesses and reviewed more than 17,000 pages of documents. While members of the administration and executive branch employees were asked by Mark's team to participate in interviews and provide records, my office did not prescribe the scope or influence the report in any way. And I want to thank Mark and his team for their exemplary work. The subject matter and details of this report are nothing short of gut-wrenching. In fact, this report is hard to read. Some of the decisions that were made by those in charge at the Soldiers Home in Holyoke are, in Mark Pearlstein's words, utterly baffling. Today, the loss of life is difficult to even think or speak about. The events that took place at the Holyoke Soldiers Home in March are truly horrific and tragic. COVID-19, as we all know, has claimed the lives of thousands of people in Massachusetts and has been particularly devastating for long-term care facilities. We all know there's a heightened risk to our most vulnerable population, and especially those being cared for in congregate living facilities. But as this report reveals, errors were made at the Holyoke Soldiers Home before COVID-19, more errors were made in preparation for COVID-19, and still more errors were made during the home's initial clinical response to the pandemic in March. Veterans who deserve the best from state government got exactly the opposite, and there's no excuse or plausible explanation for that. The report finds that under the leadership of Superintendent Bennett Walsh, the Holyoke Soldiers Home failed to prepare even before the COVID-19 outbreak occurred. Most guidance and information provided by the Department of Public Health, the Department of Veterans Services, the VA, and the CDC on how to prepare and protect residents from the spread of COVID-19 was either ignored or not promptly implemented by leadership at the facility. The report also disclosed multiple errors in judgment about infection control and resident care, including missed opportunities to prepare for defending against the virus, and these mistakes needlessly exposed innocent veterans to grave risk. This is particularly true with respect to the decision by senior leadership to combine 2 units of veterans, only some of whom were known to be COVID positive, into a single consolidated unit under deplorable conditions. A social worker's recollection of this consolidation is one of the most depressing and utterly shameful descriptions of what was supposed to be a care setting that I have ever heard of. The evidence contained in this report makes clear that there was an abject failure of leadership at the Holyoke Soldiers Home, starting with the superintendent and by other members of his senior team. The report details several other examples of poor oversight and failed management in the face of COVID-19. Delays in testing veterans for COVID-19 when they were showing symptoms. Delays in closing common spaces to prevent the spread of the virus. Failure to stop rotating staff among units and misrepresentation with regard to the facts on the ground. Inconsistent policies and practice in the use of personal protective equipment. Failure to keep adequate records and proper documentation for residents. And finally, a total failure of leadership and a complete lack of compassion for these vulnerable heroes. The report's scope is not limited to the errors and shortcomings of what took place at the Holyoke Soldiers Home right before the pandemic and during their initial response. The report also finds the Department of Veterans Services, our administration, did not properly oversee the superintendent and his team during this tenure. The lack of oversight contributed to the tragic failure to protect the veterans at the Soldiers Home when COVID-19 struck vulnerable patients in the long-term care facility. The report shows that Bennett Walsh was unable to effectively fulfill the role of superintendent. It finds that 2 positions were vacant, one at the Soldiers Home and another at the Department of Veterans Services. These positions should have been filled. Yesterday, I accepted the resignation of Secretary of Veterans Affairs Francisco Urena. As outlined in the report, the Department of Veterans Services had a responsibility to oversee Bennett Walsh and the Soldiers Home and failed to do so. Cheryl Poppy, the superintendent of the Chelsea Soldiers Home, has been named Acting Secretary of Veterans Services. We are also moving to end the employment of Holyoke Superintendent Bennett Walsh. While the situation there has stabilized and the immediate clinical deficiencies at Holyoke are being addressed, nothing short of a swift and comprehensive response is required to raise the standard of care at the Holyoke Soldiers Home to the level our veterans deserve. Immediate action has already been taken to remove unqualified staff from their positions and to put the Holyoke Soldiers Home on a path to recovery. At a minimum, we owe these changes to the veterans, their families, and the staff that have been permanently traumatized and hurt by the events that took place. Mark Pearlstein and his team outlined a series of recommendations to address the failures at the Holyoke Soldiers Home. Upon reviewing the report, we'll accept and implement all of these recommendations. In addition, we plan to introduce more reforms, including legislation to upgrade the governance of the facility tomorrow. We'll also be outlining several measures to address the trauma the staff have experienced in their working conditions. There's a very dedicated group of nurses and other professionals at that facility, which was clearly represented by the report, who haven't had the support that they deserve to do their jobs. It bears repeating that the circumstances on the ground in Holyoke since Val Liptak took over on March 31st have been stable. Many of the individuals responsible for this tragedy have been off the job for months, and Val and her team have done a tremendous job of creating a safer long-term care facility for residents and staff. Yesterday, 0 veterans across the home tested positive for COVID-19. And we will see that every effort is made in both Holyoke and Chelsea to battle COVID-19 and to provide a safe, professional place for all residents and staff. Let me close with this. I visited the Holyoke Soldiers Home many times during my tenure as governor. It's a very special place and has always held a special place in my heart. The residents of this facility represent the greatest generation. Their stories of bravery and service are unmatched, and their dedication to our state and nation has been a lifelong commitment. These veterans and their families have made countless sacrifices for the good of our nation. The opportunities for our veterans to come live and be cared for in our soldiers' homes is supposed to be a small token of our state's gratitude for their service. They are places where they can spend their final years with their brothers and sisters in arms and have access to quality health care. They are places where they can feel safe and celebrated. But as this report reveals, the Holyoke Soldiers Home failed to provide a safe environment for our nation's veterans in the wake of COVID-19 during a particularly critical period. The inadequate oversight of the superintendent contributed to the conditions that left these innocent veterans highly exposed to the ravages of COVID-19. There remains a long road ahead to repair the damage and the deep wounds that have been inflicted by this crippling tragedy. And we'll do everything in our power to safeguard the soldiers' home and support the incredible staff and their families. Today is only the first step. We plan to announce further reforms very soon and to continue to update people as we implement them.